It's great to welcome back to the show our next guest. Great to see him as well today. Dr. Marc Siegel, Fox News senior medical analyst. He serves as a clinical professor of medicine and a practicing internist at NYU Langone Medical Center. And his brand new book, The Miracles Among Us, How God's Grace Plays a Role in Healing. Dr. Siegel, welcome back to the show. How are you?
Great to be with you, Rich. Nice to be here.
Absolutely. Great to have you join us. Congratulations on the book. This is really exciting because I know for so many people, they often hear when somebody's getting surgery or somebody's really sick, we'll say a prayer for them. And many times people say that because they feel like they have to. But your book really talks about how there's real evidence about how faith plays an absolute role in that, and that prayer is not just something that it's not just a throwaway.
Well, first of all, it enables us to recognize that we're not in control of the outcomes here, and that's comforting. That relieves stress and anxiety. Secondly, that God is in charge, but it also reminds us to treasure a life, a spiritual existence, a soul, and that's good for doctors to see because it's too easy as science advances to think these things are separate. There's faith and then there's science. Well, they're combined, and they're not combined in a way that waters down science, by the way. They're combined in a way where the two augment each other, where great science is amplified by faith, and actually you can view doctoring or great doctoring as the hands of God.
And that's a really key point there, because I think a lot of people think that if you are a person of science, how can you possibly believe in something you can't see?
Well, and a lot of science is things you can't see. We're not necessarily seeing everything on the table at once. And a lot of things, again, are beyond our control. Things have to break in the right direction as we use advancing technology. We don't tell patients everything we go through, all the perturbations, all the changes in the road as things advance. We take chances all the time, but we take those chances to save a life. And I have multiple stories in this book where outcomes are unexpected and where the increasing unexpectedness of outcomes leads to miracles. Now, you can define a miracle whatever you want to define it as. The Catholic Church has a very strict definition that it has to be something with no scientific explanation, complete and utter divine intervention. But Cardinal Dolan, who helped guide me in this book, talks about soft miracles too. Miracles which are a combination of great medical advances or great number of coincidences and unexpected outcomes. So you don't have to think entirely of this can't be scientifically possible.
Yeah, and I think too that sometimes the prayers, and somebody is say terminal, it leads to extra time with them. It may not be that they're cured, but that they get extra time with you. They get maybe a couple extra months or a couple extra years. That they're not suffering, that they're not in pain. I mean, all of that I think plays a big part in this from the perspective of somebody who has a loved one who's going through something that's very, very serious, right?
Well, we have to not give up hope. We have to believe that God gives us the miracles He wants us to have, and that He has a purpose for this. Sometimes it's not the one you think it is. In the Bible, there's several examples of that. Hannah prays for her son, and He only gives her a son because the son's going to go on to be the prophet Samuel, who's a really important character in history. Bob Montgomery, the chief of surgery at NYU, just told me today that he thinks God saved his life because he knew that he was going to go on to create xenotransplant, which is the use of pig organs to save lives. He's a great pioneer in transplant surgery, yet he had been through 7 cardiac arrests. 2 of them occurred without even his defibrillator going off. The chances of that happening outside the hospital and surviving is 1 or 2% at most. And that's where I started this book, looking at unexpected outcomes. What's the likelihood of this occurring? And how does it occur just this way? And I have many, many examples of that are kind of mind-boggling, but the stories tell themselves. I said to the chief of neurosurgery at Miami, what are the chances of this guy diving off the back of a boat in the Dominican Republic, fracturing his entire spine, and not getting paralyzed on the spot? He said about 5%. I said, what are the chances of him then flying to you on New Year's Day and you operating and putting a plate in his back and solidifying him and never getting paralyzed? He says, about 1%. I said, what are the chances that he would be in a hospital room in the Dominican Republic where they let him walk to the bathroom without even a proper collar on, and only the pain from moving his neck saved him from paralysis? What are the chances of that, Rich? He says 0. So when you get to 0, you look at what the miracle is. And in each story, it may not even be the medical miracle.
And Dr. Siegel, on Veterans Day, you talk about one of the guys in the book you wrote about is Bernie, a World War II Navy veteran who worked on moon projects in the 1960s and helped to develop the famed fail-safe CWEA system on the lunar module. And actually, he helped bring the astronauts from Apollo 13 home. And you cite his story because at 101 years old, he had to overgo some amazing medical challenges.
First of all, he's now 102, and he actually was a World War II vet. He served in the Navy. And as you said, he helped design the CWEA system on the LEM, the lunar module, which is actually a precursor of artificial intelligence. And at 98, he ended up on a ventilator and surviving that. I never even heard of that. He had an emergency bowel surgery. He ended up on dialysis for the last 4 years. I've never heard of that, to the age of 102. He had a hip operated on at the age of 99. He's completely with it. And he said to me the other day, he said, the secret to surviving to 102 is that if somebody throws a punch your way, you duck. He said, and I said to him, you should have taught me that. This man's my father.
I love that, Dr. Marc Siegel. I love that. I think it's fantastic. Also, belief plays a big role in our own healing, right? I mean, for years we've heard of the placebo effect, and that's obviously a real thing. But there's also the placebo effect in the sense of if you believe that you can heal, if you believe that you can walk again, if you believe that you can overcome these things. And I know that you write about this, that as a doctor, you've seen this yourself in the patients who believed that they have the ability to recover and the ones that don't. And those outcomes are definitely distinct.
It's not exactly definable or palpable, Rich, exactly what role that plays, but it's a key role. In other words, belief in recovery is almost a prerequisite, but it's not enough. It also takes great science and it takes great doctoring. The story of Robert Redfield's son in the book comes to mind, where the chief of trauma at Maryland Shock Trauma, Tom Scalia, who's amazing, says, look, there's a couple % chance that he would recover. Even though he had a deep coma and he badly damaged 3 lobes of his brain, Redfield's son. I said, what are the chances he would recover fully? He says 0, but he's back out on the golf course now, driving himself around, completely recovered because he believed he could recover. That's part of it. The great science, the great medicine, the great healing, and the belief you can recover and the belief in God, all part of it.
So you write about Lourdes in this book, and when I was a kid, my parents, because I was raised Catholic, we were always told about the miracle of Lourdes, and I had a statue of the Blessed Mother, which had water from Lourdes in it when I was a kid. That was on my dresser, and in our family, whenever anybody got really sick, my mother or my grandmother would take some of that water and put it on them to help with the healing.
You know what's interesting is, I believe in it too, but I believe in it for a very strange reason. I interviewed Dr. DeFranciscus, who's the head doctor at Lourdes. He's an epidemiologist from Harvard, and he's a pediatrician trained in France. And he says, look, I'm a big believer, but don't think that I'm sitting here creating miracles. He says, I'm here to say that something's not a miracle. And he has hundreds of examples. Well, but he talked to me about Sister Bernadette, and he said, look, I didn't just look at her case and say, this is a miracle. I showed it to over 30 doctors and one who's an expert on the exact issue regarding the spine, the Cauda-Equina syndrome. She had a twisted spine. She couldn't pee on her own. She couldn't walk on her own. She had a club foot. She was in a wheelchair. She came here 3 days later. she immersed herself in the grotto. 3 days later, she feels some warmth coursing through her when she's home already in France. And then that night, she was able to urinate on her own. She was able to walk on her own. She did MRIs. What was there in terms of her twisted spine is gone. So he's saying, I'm verifying this medically. And even then, he says, I don't call it a miracle. I turn it over to the bishop at that point. But that is irrefutable. And the same thing with Dr. Montgomery, who says, look, after those cardiac arrests, each time something happened the same. I hear a sound. As I'm coming back, I hear a sound. He says, and then I realize that's the sound of me breathing. And I'm coming down from a big height. And I feel like I'm part of something more vast. As I come into my body, I feel more limited. And he says, that has changed how I look at life. And this is a scientist coming from a really, really serious scientist, an immunologist and surgeon. That impacted me greatly. I feel like I'm a witness to people's miracles, I'm not imbuing miracles. I'm just reporting on them.
Well, I think it's what we need right now. I really do, Dr. Marc Siegel. The book is The Miracles Among Us, How God's Grace Plays a Role in Healing. And it's Dr. Marc Siegel who's my guest right now. I think we could use a little bit more of that in our lives right now, no doubt about that. And I love the fact that you talk about how medical advances are miracles. I mean, whether it's a cutting edge surgery, it's a cutting edge drug, it's a cutting edge procedure. We're seeing a lot more of that. I want to ask you. I mean, yesterday they announced they're taking the black box warning off of estrogen for women who are going through menopause. Initially, when that came out, people said, that was a miracle to be able to help these women go through this transition. And then somewhere along the way, they put a black box warning on it. And yesterday, the secretary announced that they're taking that off. And I know a lot of women personally who are going through menopause who said, well, thank God.
Well, they were right to take that warning off because that warning was put on there because of a fear in breast cancer. To be totally fair, the science has advanced since then, and we're more aware of what the positive versus negative impacts of hormone replacement therapy are. You still got to talk to your physician. You still probably should have an ultrasound done. You should make sure that you're up to date with all your breast screening. It's not for everyone, but the problem before was that with that black box warning, a lot of women that could have benefited from this didn't take it. The number of women that took it that might have benefited was in the 20%. This will increase the number of women who take it, but it shouldn't be a carte blanche. It should be a way of overcoming the fear. So I'm all for it.
And what about testosterone for men? Because I'm getting to that point now where I'm looking at should I get a little testosterone check and see how I'm doing at my age, Doc?
Well, like with women, it's an individual decision because of risk of prostate cancer, risk of heart disease, risk of making your blood thicker. It depends. It depends on you. It can make you more vital, and it can overcome fatigue, and it can make you, more virile. But you have to make sure that the benefit outweighs the risk. That's always the way we look at it.
When I think about the miracles among us and medicine, and I think about people that have overcome great struggles and great battles and have defied the odds, I also think about how people's own personal attitudes, and there's a lot of science on this, their happiness, their level of comfort and joy in their life. And there's something about that in warding off disease. Am I wrong about that? Because I think that people who believe in something greater than themselves and who believe that they're helping other people and giving back, and a lot of that is driven through faith, and a lot of people who have belief in God and believe in church and community and do those things, they tend to be happier. And is there a link between that and then, they're getting sick less?
Yeah, there's no question about it. For science on this is right on the money with what you just said. First, there's a study that just came out that shows that the right frontal part of the brain is where miracles reside, belief in miracles reside. That's the same part of the brain where political divisiveness resides. Any belief system resides over there. So what you really want over there is something positive and generative and hopeful and kind and caring. Much better for your stress levels. And if you have a hope and you say, I'm going to put the future into the Almighty's hands, You feel less stress, less depression, less anxiety, and your outcome improves. So it's ironic, isn't it, that belief in the higher being actually puts you into a framework of better health.
It is ironic, but it also makes a lot of sense. It really does, because I think that there are so many mysteries to the brain that we don't understand. And the brain itself is an incredible miracle. I mean, it really is. I mean, just the fact that we're alive is a miracle, in my opinion. But the brain being so complex, and how much of the brain do we even understand at this point?
We understand more of it than we ever have before, in terms of the primitive centers of the brain and the cognitive centers where thinking is, but we don't understand a lot of it, and there's a long way to go, and even more to understand the mind, the soul, which have their seat in the brain, but the brain is the vehicle for the soul.
I like the way you phrase that. I really do. I like that. Before I let you go, and I encourage everybody to get a copy of this book. I think it'll make it a great gift. I personally am going to give it to my mother, because I think this book is right up her alley, and I think it'll make a great Christmas present for her. So maybe if I see you at Fox one day, I can get you to sign it for me, Dr. Siegel. The president this week announcing that the GLP-1s are going to be covered now and more affordable to people. You've seemed to be very positive about these medications in the past. Am I wrong on that?
I'm very positive about the way the president is approaching this, because in America right now, we have a central scam going on where insurance companies make deals with drug companies and obscure prices, and they're sky high, and somebody's profiting off of that, and it ain't the patient, and it ain't the doctor that's struggling to get these prescriptions approved. So maybe the president was aware that the drug companies are actually selling these drugs direct with their own pharmacies that were undercutting the very insurance scam I just mentioned. And the president said, I'm going to create Trump RX. I'm going to create Medicare, as a block. And other countries have done that before, and drug companies always kowtow. So hooray for this deal. As far as the drugs themselves, we make this hormone in our body, but we make less of it as we get older. And I think exercise increases it. I'm all for the idea of eating better, sleeping better, exercising more. But if you're in trouble and you're obese and you're at risk, these drugs make a lot of sense. And they also have other benefits, like they help the heart, they help blood pressure, they probably help the brain, decrease your risk of dementia. They're good for the kidneys. They're not for everyone, and they need to be prescribed by people who know what they're for and how to use them. But they're very exciting drugs, yes, and they need to be available.
When I was on America's Newsroom this morning with Dana Perino and Bill Hemmer, your friends, and we were talking about sleep and how a lot of Americans are not getting it right now, particularly kids. And I think I read somewhere, because I've got young kids, and my son's 11 today, 77% of America's kids are not getting enough sleep. That scares me, because I know that that's affecting their hormones. And a big part of the reason is these screens, right? These screens are keeping these kids from getting the sleep that they need.
Well, if you believe in the devil, you would actually say that the screens are of the devil's making, to use an old adage.
Something my grandma used to say. Yep.
Right. And because I'm not against iPhones, and I'm not against social media, but there's a lot of bad actors there, as the FBI has said, where they draw you in, and then you get bullied, or you feel bad about yourself, or you're not up to the image you see on the screen, or or you're competing, or you can't sleep, or you get addicted, and it's taking the place of what we're really supposed to do, which is have human contact. Develop our empathy, our sense of compassion and caring. Hard to be empathetic to a screen. So I think it's definitely going in the wrong direction. I think it does disrupt sleep. And I think sleep is generative. There's no question about it. You know what sleep happens when you sleep, Rich? Your body vacuum cleaners out your brain, literally. Yeah. The spinal fluid fills with byproducts of metabolism. So you're rejuvenated as you sleep.
And I think the last point on this, and as you point out in your book, the miracles among us, how God's grace plays a role in healing. You point out that the heart is a really amazing thing, and the heart itself is electromagnetic, right? I mean, the heart, and so when you think about love, and you think about companionship, and you think about empathy, and you think about all those things you just said, heartbreak very, very real. And so I guess when people are going through heartbreak, it's not a bad idea to give them, pray for them that they get through it, because it could be a very, very tough time in their lives.
Yeah, it's ironic how you put it together with the physical heart. I was thinking that when I send an emoji around of a heart, I always use the actual physical heart with the blood vessels because I'm a physician. But there are actually syndromes where you can have a heart attack from that degree of stress with grieving. And I think it's a time when we really ought to reach out to each other. You know, we did it post World War II. We understood that the world had been put at great risk by the Nazis and by the Japanese, and we came together, and we were in a world of post World War II positivity. And I know I'm generalizing, but we've gone down back to a period of divisiveness and hatred and rage and political, discourse, and we have to move back in the direction of healing and generativeness and kindness, and that's what my book's about.
And I think it couldn't come at a more opportune time, a more needed time, I should say. It really is a time that we need the miracles among us. Dr. Marc Siegel, congratulations on the book. It is available everywhere. The Miracles Among Us, How God's Grace Plays a Role in Healing. Dr. Marc Siegel, thank you so much for joining us here. Best of luck on the book.
I will sign and inscribe one to your mother, Rich. Don't worry.
It'd be my honor. Thank you, my friend.
Thank you.
The Rich Zeoli Show.